I provide Naplex tutoring, one-on-one and group sessions. Still working on a group session schedule and reach out through the chat. If you have taken the Naplex and have a score report, or if you have taken an assessment and you're not sure how to proceed, feel free to reach out via messages. Wad, welcome. Genesis, Tara, Autumn, welcome. Today we're going to be covering common skin conditions. Mercedes, Art, Seawade, welcome. And for those of you that are new to these sessions, this presentation is going to be uh, kind of condensed. I use RxPrep and Naplex now for resources, and both of them are good. If you feel that your topic is not covered well, feel free to supplement with extra notes. Peacock, Vicky, Tony, and Nikki, welcome. Suspicious Bunch, welcome. Before we begin, thank you to Pharma Turtles and Suspicious Bunch and the PharmaPrep Discord for putting this together. If you look in the resources, Suspicious Bunch has a guide for the Naplex for PrEP, as well as HIV as a topic. They are phenomenal. Do take a look. If you have any questions, save them for the end, whether they're for the presentation or the practice questions or the Naplex or MPJE in general. Feel free to bring those up at the end. All right, let's continue. So first, the background, along with drugs that cause discoloration. A pharmacist is expected to know the difference between cancer or medication-caused skin discolorations. Now, it doesn't mean you're going to be doing a skin screening on every patient you come across, especially in retail. But if a patient comes to you and says, for example, that I'm sweating brown and it's staining my clothes, by checking their medication history, you should be able to mention that, hey, if you're taking entacapone or levo or methyl dopa, that hey, this is an adverse effect and or a side effect, and do not be alarmed or wear clothes that you don't mind if they get stained. So some of the common discolorations: iron causes black stool, red secretions, anthracyclines, and your urine can change into a reddish tinge if you're on deferasirox. Blue, methylene blue, or mitoxantrone. And mitoxantrone is actually a misnomer because it's also an anthracycline. Why they didn't, why the name is different is beyond me, but know that it is an anthracycline, but it does cause secretions to turn blue instead of red. Orange yellow, sulfasalazine; yellow green, propofol or flutamide; brown yellow, we have nitrofurantoin, metronidazole, tinidazole, and B2, the vitamin. Can anyone put in the chat what the brand name is for nitrofurantoin or metronidazole? One or the other, or if you're really fast, you can put in both. Next, we have red orange, azo, which is over the counter for UTIs, symptomatic relief, rifampin, and rifapentine. All right, good, everyone. We got Flagyl, we got Macrobid, and I know that if you typed in flagella, it probably autocorrected. Good job. Good job, everyone. So, next we have natural products. And aloe is the number one. It comes from the aloe vera plant. You can get almost pure aloe vera prepared and or purchase it. This is used for sunburn or psoriasis, and there are other conditions that you can use it for. It is soothing. There is not a curative effect. Next is tea tree oil. It's used for acne, for itching in lotions, and as an adjunct for onychomycosis. Now, it does not eradicate, but it can treat it and reduce or lessen the symptoms. Now, you're probably thinking, oh, onychomycosis, is a cool Wi-Fi password. If you decide to use that, don't invite me over. I'll use my data. Next, we have lysine. Lysine is used for cold sores caused by herpes simplex labialis, or that is also the name of the condition. Biotin B7, biotin, which is vitamin B7, is used for hair loss and brittle nails. And last, we have topical vitamin D, which is used for diaper rash and psoriasis. On the right, bottom right of the slide, you'll see that is psoriasis. Psoriasis is an autoimmune condition, and you will see lesions like that with scales. However, the scales may come off, or if they come off, there may be bleeding. All right, a fun one, acne vulgaris. And when I say fun, I'm using air quotes, but you can't see me. There are three main reasons. Androgens, which are the male hormones, bacteria, which is Cutibacterium acnes, but it's not cute at all. Ask any teenager in high school that has moderate or severe. It is difficult to deal with. And then fatty acids or sebum. We classify it, I mentioned moderate and severe, and there's also mild. Top right, you should see a picture where there are blackheads, whiteheads, nodules, papules, and pustules. And um, the main locations are going to be your face, chest, back, and shoulders. And for some, dairy or a high glycemic diet can trigger it. And actually, this is anecdotal, but I have a cousin who is not lactose intolerant, but she says every time she has dairy, she breaks out quite a bit. And so next we have whiteheads. These are closed. So I've heard comedones or comedones, however you pronounce it. That is fine with me. We are not being tested on pronunciation, which is a blessing. Blackheads are the open ones, and then the others we have covered. Nodules can also be referred to as cysts or cystic acne. Some over-the-counter treatment options, benzoyl peroxide or BPO, it is effective. It's also available in prescription strength. When it's available in by prescription, there's combinations with hydrocortisone, adapalene 0.1%, erythromycin, and clindamycin. It can bleach clothing or hair. Next is salicylic acid. This is available in washes, medicated pads, and lotions. And last but not least, for the over-the-counter, we have azelaic acid, and this is also it's available as topical dicarboxylic acid cream or gel. For prescription for acne treatments, we have retinoids, which are vitamin A derivatives. And the mechanism of action here is reducing adherence of keratinocytes to oil glands. And know that retinoids are teratogenic. We avoid in pregnancy and breastfeeding patients. It is well tolerated. There can be mild skin irritation or photosensitivity. Know that the mild only goes with a skin irritation. Photosensitivity can be a spectrum. Uh, Instructions are a pea-sized amount daily at night, 20 minutes after washing face. It can take 4 to 12 weeks to work. Now we have oral and topical antibiotics. Please excuse the typo, I will fix it. You have doxycycline and minocycline, which are oral. And then you have clindamycin or minocycline, which is available. Clindamycin is a cream and minocycline is a foam. Isotretinoin, this is only indicated or FDA approved for severe nodular acne. Two forms of birth control are required because it is highly, highly teratogenic, and pregnancy and cholesterol tests on follow-up are required. For the pharmacy to dispense this, you need to be a part of the REMS registration and the iPledge specifically. Isotretinoin is only dispensed 1 month at a time. The next prescription, we have 15 to 20% azelaic acid available in cream, gel, and lotion. I wanted to clarify with the OTC, the percentage strength for azelaic acid will be much lower. All right, next we have cold sores. This is caused by herpes simplex labialis. It is common and highly contagious. It is spread by active lesions, kissing, saliva, oral and genital intercourse. The top right, the picture that you see, this on the left side, this is an internal lesion, and on the right side, it is external. It can be upper or lower lip, which is the most common sites of this lesion. Now, it can be caused by the herpes simplex virus 1 or 2. It used to be that 1 was considered above the waist and 2 was considered below the waist, but now there is no such pattern anymore. Uh, Cold sores can be accompanied by or preceded by prodromal symptoms. And here we have tingling, itching, and soreness. And most lesions happen in the same place when they recur. So this can be caused by fatigue. Outbreaks is another term that's used, and it can be caused by fatigue, stress, sun exposure, acid peels, the facial treatment sometimes, and dental work. Over-the-counter treatment is docosanol, which is Abreva. The instructions are apply 5 times daily at first sign of outbreak until healed. Prescription, we have Zovirax cream, which is acyclovir, Cidovig, which is the acyclovir buccal tablet, and Denavir, which is pencyclovir topical cream. The next topic we'll cover is dandruff, and this is going to be the scalp is itchy, scaly, there are white oily flakes in the hair, and also present on the shoulders, back, and clothing when people shake their hair or brush their hair. So, dandruff can be eczematic and it can also be a fungal cause. Dandruff can be worsened by hormones, weather, shampoo. Some people use different products. You try a new one and it can not react well with your skin. Seborrheic dermatitis is an eczematous form. It can also cause, besides dandruff, it can cause peeling of the eyebrows, at the nares, which means to the left and right of your nose, behind the ears, and chest. Now, seborrheic dermatitis is a dandruff that can be worsened by cold, specifically. Next, we have treatment options. And before we do that, if you look on the bottom right, there's a picture of a normal scalp, dandruff, and then seborrheic dermatitis. Seborrheic dermatitis, it's not shown in the picture, but besides dandruff, they'll also have redness where there's itching. So, over-the-counter treatments are going to be dandruff shampoos, and that's like Head and Shoulders, which has selenium sulfide, um, or any brands that are marketed. They can also have ketoconazole 1% over the counter. Some may have multiple ingredients, so with or without. Pyrithione zinc is another ingredient used. I believe that's Selsun Blue. And then there are coal tar shampoos which are available, which Selsun Blue also makes a coal tar variety. Prescription, we have 2% ketoconazole shampoo. All right, our next topic is alopecia. So naturally, with age, your hair will thin, but alopecia addresses hair loss. So it can happen with age. Other causes are hormonal causes, so pregnancy, childbirth, menopause, and low T. And medical conditions that can cause alopecia are hypothyroidism, alopecia areata. It looks like I'm a victim of autocorrect. And areata is Areata, and that is an autoimmune condition where the hair follicle is targeted by autoantibodies. And then lupus, and there's certain medications that can cause it. Hereditary male pattern baldness is most common. There's also female pattern baldness. Zinc and vitamin D deficiency can also contribute to hair loss. So I mentioned earlier that there are drugs that can cause alopecia, and that's chemotherapeutics, valproate, tacrolimus, and heparin. Now, the specific mechanism behind chemotherapy causing hair loss, the turnover and cell division in the hair follicle is high, and therefore, uh, we know that anywhere there is high cell turnover, chemotherapy can affect that. There are certain uh, options if you're on chemotherapy and you're trying to preserve your hair. A cryocap, CRYOCAP, is a modality that's used and essentially cools your scalp. And so by reducing blood supply, it may reduce hair turnover and chemotherapy distribution. So let's talk treatment options for alopecia. And the picture on the right shows alopecia starting. Finasteride, if anyone can tell me the different brand names for finasteride, I know there's two main ones. And while we wait on some answers, we have baricitinib, which is Olumiant, and this is for severe alopecia areata. Minoxidil topical is available over the counter. Brand name is Rogaine, and you have 5% foam and 2 or 5% solution. I see some answers coming in. We have Proscar and Propecia. Very good. Very, very good. All right. Before we do eczema, I just wanted to let you know I won't be able to cover fungal skin and nail infections today. They're very, very important and they're very, very high yield. And I will, if we do this topic again in a couple weeks, I will add to the slides and redo those. So eczema is the next topic we're going to cover. If you look in the top right, this is an example. It's mostly seen on what we call the flexural surfaces, and it's also seen commonly in children. It is an inflammatory skin disease. There will be dryness, redness, itchiness, and you can see it on cheeks, arms, legs. And in adults and in children, it can be associated with asthma and allergies. They call it the allergic triad. So we can reduce symptoms with topical corticosteroids. For mild cases, we use a low potency topical steroid such as desanide or hydrocortisone. Note the percentages are important in differentiating between low potency, medium, and high potency. Steroids as a class is very high yield, and knowing the brands, sorry, not the brands, the different types and then the different potencies and their percentages are important for you to know. So for moderate disease, you have medium to high potency topical steroids such as triamcinolone 0.1%, fluocinolone 0.025%, and betamethasone 0.05%. Second line treatments are going to be topical calcineurin inhibitors such as Elidel or tacrolimus and pimecrolimus. Uh, Once again, if you use that as your Wi-Fi password, uh, that's tough. We have 1% cream. You can apply BID for greater than 2 years of age. There is a potential risk for cancer with calcineurin inhibitors. And for second line, we're going to use them short term. Tacrolimus, the brand name is Protopic, is going to be 0.03%, and it's also available in a 0.1% ointment applied BID greater than 2 years of age. Another second line is going to be a PD4 inhibitor, Eucrisa, and this is going to be similar instructions in a 2% ointment. And then last but not least, we have Dupixent. And this is going to be an interleukin 4 alpha antagonist, and it is sub-Q. If you're on this, you counsel the patient to avoid live vaccines. It is refrigerated, but you want to bring it to room temperature 45 minutes prior to use. All right, now we have diaper rash. And this is very common in infants, toddlers, disabled adults. And one other thing is if they have loss of bowel or bladder function. So, as adults, due to friction and contact with urine and stool, the skin barrier is broken and bacteria yeast overgrowth can occur. We have prevention to change diapers often and do not cover the diapers in plastic. Wipe well with unscented wipes or rinse with plain water. Let skin air dry when possible, and use skin protectants like petrolatum ointments with or without zinc oxide. Now, zinc oxide is what we call a desiccant, and it dries, or it assists with drying. Does anyone know a brand name for yellow petroleum ointment and white petrolatum ointment? There's two main ones. Um, does anyone know the brand names? And these are over the counter. So while those answers come in, treatment, we have nystatin, clotrimazole, or miconazole if yeast is suspected. Hydrocortisone 0.5 to 1% cream can be applied BID for a few days. You also have to know that these can be mixed bacterial and yeast infections, and make sure you counsel the patient to refer to pediatrics if not getting better or if the condition worsens. So I have Vaseline. You've probably heard of Aquaphor and Desitin. I'm going to verify. I'm familiar with the paste, and it does have zinc oxide in it, so yes, I will give it to you. Very good. Good job. So, steroids. Here's a list of the topical steroids that we use for common skin conditions. These were bolded on both RxPrep and past Naplex now. Fluocinolone, which is Cinelar, and it's for psoriasis. You can massage oil into scalp and leave on for 4 hours and then rinse. If you're treating an inflammatory dermatoses, we use an ointment cream, um, QID. Uh, you can also use fluocinolone for plaque type psoriasis. Excuse me. Seasonal allergies kicking my butt. Desoxymetasone is known as Topicort. This is available in cream, ointment, gel, and spray. Clopidogrel, which is Temovate E. Now, clopidogrel can anyone tell me what potency that is? And there's a specific area or several specific areas of the body where you're not supposed to use clopidogrel. Now, if you're new or if you're unsure, do not be alarmed. Just make a note of it and make sure you go over it today or tomorrow. And um, And this is the place for you to learn, and this is the place for you to make mistakes and be unsure. So when you take the Naplex, you knock it out of the park. Good. So yes, no genitals or face or perineum area, and it is high potency, and good job with the percentages. Good, good. A side effect of clobetasol and long-term steroid use is skin thinning. So augmented beta-methasone dipropionate, there's valeriate, which is a Luxic foam, mometasone, triamcinolone, and prednicarbate. All right. A study tip for you is rather than just trying to memorize the names, associating the names, both brand name and generic, with possible treatment options. As you know, the Naplex loves to give you a long question stem. So if you know, hey, this is for psoriasis, these are the different forms, uh, how we're going to counsel the patient, and uh, adverse effects or interactions. That may help you besides just straight memorizing. All right, so now I have three practice questions, and the situation with the practice questions are if you're new, I'll read them out, and when I'm done reading the question, you can put the answers in the chat, and we'll go over each answer and break them down. So, practice question one, which of the following is not a common physiological complication in the aging of an elderly patient? Select all that apply. Choice A, we have skin thickening, increasing the risk of skin and soft tissue infections, slow GI tract, and possible reduced absorption of vitamins and minerals like B12 and iron. C, a drop in GFR, which can contribute to the accumulation of many medications. Choice D, increased concentration of albumin due to loss of intravascular fluid dehydration. And E, loss of muscle mass, reduced physical conditioning. So this is a select all that apply. And know that on the Naplex, it can be one, all, or anything in between. And I've mentioned that both RxPrep and Past Naplex now do a really good job in not setting up patterns in the questions. All right, very good. So I have several responses, and let's go over them. A is correct. Um, A is backwards. There is thinning of the skin, and that can lead to a possible risk of infections due to abrasions and breaking of the skin barrier. So if you chose A, great job. Next is B, slow GI tract and possible reduced absorption. So the GI tract actually speeds up, and that makes this incorrect. Choice C is a drop in GFR, which can contribute to the. Oh, I'm sorry. I'm sorry. Let me back up. B is common. It does slow down. I'm sorry. It does slow down, and there is possible reduced absorption. Choice C is also correct as written. There is a drop in GFR, which can lead to accumulation of medications, which can also lead to toxicity. So C is correct as written. Now, choice D. D is a correct answer choice. There is not an increased concentration of albumin. There is a lower level of albumin, more likely with malnourishment. This can increase the free fraction of many drugs, such as warfarin. And then choice E is correct as written. There is loss of muscle mass and there is reduced physical conditioning. So if you chose A and D, good job. And if you chose C or E or B, you may have been confused with not a common physiological complication. All right. Any questions or concerns for this practice question? Remember, there are two more. So the question is to explain D, and choice D says increased concentration of albumin due to loss of intravascular fluid and dehydration. The cause is actually it's actually decreased albumin due to malnourishment. Remember, albumin is a protein and it needs to be made. And if there's reduced absorption, then there will be reduced albumin. Great question. I hope that clarifies it. You're welcome very much. Anyone have any questions or concerns for practice question one? All right. So we'll continue to the next practice question. Same rules. I'll read it and you put your answers in the chat when I am done reading. A 66-year-old female was recently started on Lamictal. What is an important educational point that this patient should look out for? Choice A, the medication can cause discoloration of urine. Choice B, immediately report any signs of rash to provider. C, the medication should not be taken with Tylenol. And choice D, the medication can cause muscle soreness. Also, if you can put in the generic for Lamictal, that would be great. All right. So I see a lot of responses and I see some brand names. So let's discuss. Choice B is correct. And the brand name is lamotrigine. Good. Lamotrigine can cause severe skin rashes, and this can require hospitalization, and there should be immediate discontinuation of this medication. So the statistic is within 2 to 8 weeks of starting treatment. However, there can be an isolated case after long-term treatment. So this, both the prescriber as well as the pharmacist should make sure they counsel the patient about Lamictal and any sign of rash. Very good. Did anyone have any questions or concerns about practice question two? That is an excellent question, and I am going to look that up. Excuse me. I believe it's a type of hypersensitivity reaction, but I'm just going to clarify that for you. I'm going to mute for a second to cough. Great question. All right, so it is hypersensitivity. And excuse me. What I'll do is I'll put it in the chat. I'll find the exact type of hypersensitivity and I will provide it to you. Very good question. All right, so let's go to anyone else have a question? Hard to top that one, Seaweed from downtown. Good question. All right, so let's go to practice question 3. A 17-year-old girl experiences a severe flare of acne. She has not responded to topical benzoyl peroxide wash and oral minocycline. You are concerned about scarring potential and decide to start her on isotretinoin. You counsel her on the side effects. Which of the following is not a side effect of isotretinoin? All right. Everyone getting their answers in? All right, very good. Oh, Art, yes, I'm sorry. I can read the answer choices. A for depression, B, headache and blurred vision or pseudotumor cerebri. C is hyperpigmentation. D is photosensitivity. E is teratogenicity. Teratogenicity. Also, Seawade from downtown, it is a type 4 hypersensitivity reaction, and it can result in Stevens-Johnson syndrome or toxic epidermal necrolysis. Necrolysis. All right, very good. So the correct answer is going to be C. And hyperpigmentation is not a side effect. However, we know choice E is. Choice D is also photosensitivity, and headache and blurred vision can also be a side effect, as well as pseudotumor cerebri, and then depression as well. It's not just depression, any mood changes can be seen, and that can be suicidal ideation, dysthymia, and also hyperlipidemias. Isotretinoin, you need to do cholesterol in the follow-up tests, and there can be arthralgias and myalgias. So, this is practice question 3, and the choice was C. Good job if you got it. Now, does anyone have any questions or concerns for the practice questions, the topic in general, any Naplex or MPJE questions? And as always, you can always send me a direct message to discuss things if you would like. Happy to answer any questions or concerns that you may have. Everyone is feeling good today. No questions about common skin conditions. All right. So if nobody has any questions, remember you can always direct message me. There will be a survey after. Please available. Please fill that out so we can know how we're doing, any improvements that can be made. Thanks to Pharma Turtles and Suspicious Bunch. And just know that the Naplex is a beast that can be slayed. Many students and graduates take it. Many struggle with it. They have before you were in school, and they will long after you have passed it. Keep trying your best, and all the best to you. Tomorrow, looking forward to seeing you tomorrow. Take care, everyone. You're welcome.